All right, so continuing on with task number 21, I am going to now perform the postmortem exam on my friend Sunny here. Again, just to make sure I'm safe, I have my PPE, which is gloves, lab coat, and goggles. I have my friend Sunny here. Again, he's approximately a 4-year-old male neutered feline, domestic short hair. Owner again elected to humanely euthanize a little while ago, and gave us permission to do a necropsy on him just to see if we find anything. Right here we just have a little boo-boo bandage from where we pulled the catheter out of his leg from where we euthanized or gave him the euthazol. So I'm going to go ahead and I'm going to start with my postmortem exam. I just have a pen and a clipboard over here that I'm just going to be writing any notes for my postmortem exam. So I'm going to start with doing my external appearance of him, an exam just to make sure that, just to check if there's any lesions, any growths, any parasites, anything at all that I can see with my physical eye on his external surface. So I'm going to start up on his face. I'm going to look around his eyes, which I don't see anything concerning, no lesions, no growths. His nose looks pretty good. I don't see anything on his neck, nothing with his ears. Oh, and Mom did mention that they actually only have had him for the last couple of years. Apparently he was a stray cat that kept on coming to their house a lot, and they kept on feeding him a lot, and eventually he started going into their house, so they kind of adopted him. So the guess is that, he's approximately 4 years old, but he could be older or younger. We don't really know. Hence why he has one tip of his ear chopped over here. That's generally what they'll do if it was a stray cat at one point or another. I'm going to look in his mouth just to see if there's any growths. Looking up on his soft and hard palate, I don't see any growths or any lesions at all. All around his upper jaw, I don't see any growth or lesion, the maxilla. On his mandible, again, I do not see any growths or any lesions at all. I'm going to go ahead and pull out his tongue and look on the top of his tongue, which I don't see anything. Underneath his tongue, I don't see anything either. Okay. Good job, bud. Sorry. So now I'm just going to continue to look at the rest of his body just to check for any lesions or any growths. And so far, I'm not feeling or seeing any lesions or any growths at all. While I'm looking, I'm also looking for any parasites that might be on him. So no growths, no lesions, no parasites that I see. Just gonna raise up his leg a little bit, look on his belly. Alright, I still don't see anything. So right now he's in left lateral recumbency, so I'm just going to gently flip him to be right lateral recumbency just so that I can see his other side, just to make sure he doesn't have anything on that side that's hiding. Fortunately, he urinated a little bit after we euthanized him, so he's a little wet back here. He just has a little darker skin right there. Not any lesions though. Just the pigment of his skin looks like it's darker in that area. Okay. And again, I'm still not seeing any growths, any lesions, any parasites at all. So I'm just going to go ahead and just write that down on my record. Any lesions, I'm going to say none noted. As far as any growths, none noted, including oral exam. As far as parasites, none seen at all anywhere on body. And then one of the final things I just want to do on my post-mortem exam of the external, before we go internal and do the necropsy, just want to write down his body condition score. So as I'm looking at him, he looks like he is well proportioned throughout his body. He doesn't have any muscle wasting or any muscle loss anywhere at all. So he has even muscle mass. He has a small amount, but he doesn't really have any abdominal fat noted down here. And then as I feel down his spine and into his pelvic area and on his ribs, I don't physically see, his ribs, his spine, or his pelvis at all, but I can easily, if I go like this, I can easily palpate them. So I'm going to give him a body condition score of a 5 out of a 9 because I feel that he is at an ideal weight and ideal body shape for a feline. So again, body condition score of my friend Sunny here is a 5 out of 9. Did not see any lesions, did not see any growths anywhere, including the oral cavity, and I did not note any parasites on him. So I'm just going to go ahead right now. I'm going to place him back to his other side so that he is in left lateral recumbency. So we're just going to go like this. 1, 2, 3. Okay. I'm going to get him centered in the middle of the table. Okay. So now Sunny is back on his left side in left lateral recumbency, and I'm just going to go ahead and get the doctor who will be performing the necropsy aspect of task 21 with me. So again, that's how you do the post-mortem exam of the external surface of a patient. He's in left lateral recumbency, and I'm just going to go grab the doctor to let her know that I am ready to perform the necropsy with her.